All new at 4, this is the 50th anniversary of National EMS Week. It highlights the life-saving work of paramedics, EMTs, and more. And now in Denver, they can even do more. Get this, EMTs and other first responders are now able to leave doses of naloxone, also known as Narcan, with patients and bystanders who may be at risk of overdosing. Joining me now to talk more about that is Dr. Andres Camacho, the Associate Medical Director for Denver Health Paramedics and an emergency medicine physician at Denver Health in the ER. Dr. Camacho, thanks so much for being here and talking about this.
Thank you so much for having me.
All right, this is an interesting idea, to leave the naloxone behind. Tell me how the program works.
Yeah, so the purpose of this grant-funded program is essentially to leave behind Narcan in the hands of those that need them. So as we know, with the rising number of recreational drugs, including fentanyl in the streets, the opioid epidemic is really a public health crisis. Denver paramedics gave 1,400 doses of Narcan in the last year, and since 2020, we've had almost 2,000 overdose deaths in the state of Colorado per year, with concerning increases in teenagers, African Americans, and Native Americans.
Okay, so obviously there is a need for this. There are a lot of people using drugs, and we know opioids get in the system. It doesn't take much of it to cause a deadly overdose. So how often are paramedics and doctors sort of giving patients and their family and friends the naloxone?
Yeah, so one of the novel parts of this grant is making it so that we have Narcan in the hands of those that need them. So Denver paramedics serve as the entryway for into the healthcare system for many of these patients, and we know that first interaction shapes how they perceive healthcare. So we're trying to leave as much Narcan as we can in the hands of those that need them.
Now, there are going to be people who hear about this and say, while it may help some, doesn't it just enable people to continue to keep on using drugs as opposed to stopping? How do you respond to them?
Yeah, so we know that Narcan saves lives, and we want to give our patients a second chance so that they may seek recovery. Now, it's easy to think of addiction and substance use disorder as a character trait, as character weakness, but I really believe it's a medical condition that with the right treatment can improve. So these patients that can have their lives saved can recover and eventually contribute towards their community.
All right, Dr. Andres Camacho from Denver Health, thanks so much for sharing the program today. I appreciate it.
Thank you so much for having me.